As various countries across the globe ease COVID-19 restrictions, especially when it comes to the use of masks, the Ministry of Health is warning that Kenya isn't out of the woods just yet. Now, according to global health experts, COVID-19 will become commonplace, but that doesn't mean that the disease is no longer deadly. And as Raquel Muigai reports, health officials are advocating for worldwide vaccination so as to mitigate the severity of the disease.
For more than a week now, Kenya has recorded less than 100 new COVID-19 infections daily. At the moment, the country's positivity rate stands at 0.4%. Given the scenario of few severe cases of COVID-19 reported, a number of Kenyans have opted to do away with what had become the norm, masking. The Ministry of Health is, however, issuing a warning.
We will continue to maintain, I think, the non-pharmaceutical requirements because that is what really is our first line of defense in terms of curtailing the transmission of the virus. And we are not done with the virus yet. The fact that we have overcome the Omicron wave does not mean we are done with the virus.
According to Dr. Githinji Gitai, the Chief Executive Officer at Amref Health Africa, it is time to reduce mask mandates to accelerate last-mile vaccine access in Africa. In a statement on Twitter, he says, I quote, "All signs indicate we may be moving from pandemic to endemic phase of COVID-19. However, this doesn't mean that the mask as a tool for fighting the pandemic is discarded, but must be retained and used based on data such as levels of community transmission, location, vaccination rates, hospital capacity, and a policy framework to guide decisions." Last week, governors in 10 states in the United States leapfrogged federal recommendations and dropped mask mandates. Cities, counties, and school districts are free to maintain their restrictions and requirements in those states. Additionally, France is to drop mandatory mask wearing in enclosed spaces like pubs and museums, where the vaccine pass is required from February 28th.
We don't know what to expect next, what will come up next. We are, as a country, not yet vaccinated to the level that we want, which is about 70% of the population. So we still have a long way to go, and we need to be cautious. We don't want to, throw everything to the wind and open up everything, and then we are struck with another serious wave.
This comes as the Ministry of Health commissioned 2 locally manufactured test kits, one for malaria and the other for COVID-19. The 2 rapid diagnostic kits had been launched by President Uhuru Kenyatta in July last year and were awaiting approval from the Pharmacy and Poisons Board.
We aspire to save this country in excess of 58 million shillings annually on malaria testing and also 405 million shillings on COVID testing.
The COVID-19 test kit, the ministry says, will help reduce testing costs for Kenyans, given that it still remains a global health issue. Raquel Muigai, Citizen TV.